I'm James Woollard. I'm a consultant child and adolescent psychiatrist at Oxley's NHS Foundation Trust and a senior fellow at Mental Health Technology and Innovation working on national policy around technology in mental health. I was given the unenviable task of talking about the state of play of artificial intelligence in mental health, some of which we may have covered already today. So I'm going to go, I hope, in a kind of entertaining way through some high-level thoughts on this area. And I wanted to start with an NHS digital carol. So the ghosts of the carol, that famous carol, the ghosts of the past for the NHS, perhaps around digital, are poorly designed systems, the national programme for IT, lack of end-user engagement. That is perhaps our ghosts of the past. The ghosts of the present, anxiety about the pace of change from frontline clinicians, overblown claims about and hubris about the potential of technology, and concerns about the evidence of the effectiveness of that technology. And I think if there's a ghost of the future, it's been said by some very important people that we'll all be replaced by robots. So I think that's definitely the ghost of our future that we're staring down at. So, continuing the Christmas theme, the presence of therapy, the black box of therapy. You walk into your therapist's room, you sit down, something happens, you walk out. What happens in that room might depend on the therapist you're seeing, and we've already heard in the debate earlier, I think it was Alison that mentioned it, in terms of the importance of that connection that you have with your therapist. And at the moment, there are some formulations and theories that help us understand that, but do we really understand that? Why do we get that variation in care? And actually, that variation in care as a policymaker has critical impact on the cost effectiveness of the system, how much money we have to spend. So we need to open up that black box of therapy. And if we're being criticized by people like Matthew Said in his book Black Box Thinking about the fact that we don't collect enough data about therapy to understand why it works, I think we need to have to listen to that. So let's open that black box of therapy. And I think just moving on in terms of, we've already talked a lot about chat agents or conversational agents. And I suppose that's one way of trying to unpack or unload that box. There's a couple of things that I didn't think came up in the debate. The first chatbot was programmed in 1964. This isn't a new conversation. We are 40, however many years later it is, maybe even 50 years later. And yet we're still kind of working out what we think about this. That somehow seems, as a millennial, a borderline millennial, maybe a bit Gen X, an anathema to me. And I look on my Twitter list where I've curated all the AIs or chatbots that are available, and none of them feel very satisfactory as a therapist. And I think some of those reasons have already been talked about. And we look at the evidence, Wobot, the recent paper published in JMIR, 70 individuals in their unblinded trial, hardly convincing, and yet promising, as we've heard. And I agree about the gap and which gap we're talking about as a policymaker. Many of these available chatbots are really based on very limited responses, on logical algorithms. They're not very truly responsive, and I find that very frustrating. And yet, when I look at something like that, it kind of feels a bit like how my Christmas decorations came out of their pack when I unpacked them from the loft recently. But when I look at this kind of diagram of a neural net, and I'm like, okay, that's a bit complicated. How do I begin to understand that as a frontline clinician? How do I begin to trust that, let alone with somebody who might have a reasonable understanding of technology and machine learning? How do I begin to explain that? And I think we've already highlighted in the debate about actually your right to understand how your data is being processed. What's that right? And actually with GDPR coming next year, that right is even more enshrined. How do we explain this stuff? What's the regulation? And I will be candid with you that we are still, as policymakers, working out how to have that conversation. And my colleagues have convened the Digital Clinical Council at NHS England, where we are trying to bring together the clinical expertise across the arm's length bodies to try and help us think about how we think about these difficult, knotty, tangled conversations. So, the Oracle of Delphi, the future. We've been probably preoccupied with the future ever since we had a sense of time as human beings. And we may look back on those who believed the Oracle of Delphi as rather slightly naive, that she was standing on, or they, as there were many of them, standing on top of a psychoactive gas emitting from the volcano their shrine was housed in. And yet actually perhaps we're standing on a technology volcano which is emitting gases that promise the psychoactive properties of technology. But should we believe them? Should we be like those ancient Greeks and Romans who believed in the Oracle of Delphi and acted upon them? Or should we be a bit more cautious? We are in danger of making acts of omission as much of commission in this space. And as a policymaker, how do we do that? And yet the future is promising. The future is where policy happens in terms of prevention and prediction of the need that the system has or individuals within that system. And I suppose one of the things I find frustrating on many levels is understanding the difference between the signal and the noise. We may collect 900 bits of data from your smartphone about what you've been up to. What on earth does that mean? What's the signal within the noise that we need to understand? And I still think that's a fundamental challenge of much of artificial intelligence and machine learning when it comes to mental health and us as human beings. But as a policymaker, how do I find the signal within the noise of research? There's an awful lot of research going on out there. How do I find the signal? And if some of you were at the debate of the launch of the policy research unit, mental health policy research unit at UCL, I'm looking forward to seeing how they can help us find the signal in the noise. There is some good work going on, and I wanted to highlight the work of people my colleagues at Merseycare who are working with Stanford Risk, really promising work around suicide prevention. I wanted to highlight the work, in fact, actually Sophie highlighted it earlier, of the Good Thinking platform that's being launched across Londoners, using data from technology platforms to help target mental health, or those who might be experiencing mental health problems, that digital outreach into London as really important examples, promising examples, cautious steps, perhaps. And I wanted to finish with a philosophical note. Ryle critiqued Descartes about his mind-body dualism. And he argued that there's no such thing, there is no such thing as the ghost in the machine. We are one. And I suppose some of the debate highlights that we are still in a mind-body split when it comes to digital, or mind-digital split. And actually I would argue, and I think those in the transhumanism camp would argue that there's no such thing. There is no ghost in the machine. We are one. We are one identity. We exist across many different platforms. And that really is going to start asking many different questions of us. If I write a chatbot based on my grandmother's letters that she wrote thousands of to everybody in my family, and apparently there's a company that will do this in America. If I write a chatbot or an artificial intelligence algorithm that analyzes those letters, and she passed away recently, will that actually mean she lives on? Will her voice live on? Could I ask her questions? Would the artificial intelligence algorithm be able to answer like her? And can she transcend her passing? Should she transcend? So, transhumanism is perhaps the next greatest challenge for us philosophically. Whatever, we are moving into increasingly blended realities. The distinction between digital, mind, body, and the future and the past increasingly blurred. And I would like now to hand over to our first talker, or next speakers, Mike Slade and Dan Robotham, to talk about NEON, machine learning, and mental health recovery. Thank you.